Day 73 of the doctor's strike. This is an NTV special. I'm Madowo. We're coming to you live from Power 254. We've got experts, stakeholders, interested people in the health sector to try and look at the issues behind what exactly has led to this crisis in the health sector. We've got, from my immediate left, Eric Raide is the government spokesman. Thank you so much for coming on tonight. Dr. Janet Githinji is also with us. You just came from a very busy day, so appreciate you taking time to come and speak to us. We've also got with me Peter Wanyama, advocate and health advisor to both national and county governments. You've got some interesting perspective we'll be listening to in a moment. Also on the panel today, Professor Omwanzala is an old hand in this sector. She's at the University of Nairobi, among many other things.
Okay.
We appreciate your time. And last but not least, we've got Dr. Daniel Ojuka, who's also joining us. In the crowd, we've got some doctors, we've got an economist and a lawyer and lots of other interesting people. We'll get through all of them. But let me start with Eric Raide. Why has it taken the government 73 days to fix this?
Well, Larry, this is a very sad thing for the national government. This is something we would have wished as a government that never happens, or the same it happened. We mobilized very fast without reference to any document being called CBA or the sister or brother or the cousin to such document.
But isn't that at the center of this whole controversy about this contentious collective bargaining agreement?
Listen first. And meant we put together everybody who could come together, the treasurer and everything, made offers. Our cabinet secretary sat for the longest time. I think he has sat in his lifetime. His Excellency the President gave this a lot of time. Our Secretary General of Court came in, the courts came in, and in very brief, we have not been able to convince our very honorable doctors that we are able to save lives and bargain for better conditions and terms of service and working environment at the same time. And tonight, I can as well rise up after this message and go. Our message to Kenyans is that we can continue caring for the sick, caring for the dying, and still negotiate the kind of deal that is able to be accommodated by the government. And when I'm talking about the government, I'm talking about a government in perpetuity, not this government.
Right.
I am a civil servant, and at the same time, care for the sick and dying.
Dr. Githinji, the complaint from the government, and even in Eric Raide's 25-point statement today, seems to blame the doctors for not coming to the negotiation with good faith. That's why all the deals that have been presented were rejected.
Well, I feel like I would need to clarify that statement because, number one, the doctors have been in good faith. And even if you actually look at the issues whereby there has been a push and pull, the doctor's clarion call has remained the same. It has always been CBA, CBA. From day 1 to now day 73, we have not wavered in what we are asking for. But these increments and extra increments and inclusion of more stakeholders and including the president to also give us the deal, and then back to the negotiating table, and then the court process. But the one common denominator that has never changed has always been about implementation of the CBA. We have never said anything beyond that. We also stipulated even different ways in which it could be implemented, different ways in which it could have been faced, but there has never been a situation where any union member has ever had to engage and talk about the return to work formula. It has always been about the CBA. That has been the word that has been so consistently repeated that it resounds in every Kenyan's mind, even the ones who have not read.
Okay. The CBA obviously resounds in many Kenyans' minds, rightfully so. Yes. But the government says this, it cannot recognize it. And you're one of the people who's speaking to different governors and people at the national government level, Peter. And what are you telling them? Does the CBA stand?
Thank you very much. I think that is really the issue which is at play. And the doctor has confirmed that to insist on the implementation of problematic CBA really can't work.
Why are you calling it problematic?
Let me explain a major issue here. The CBA was signed in June 2013. Now, the doctors went to court in 2015 to enforce the CBA. Then the court said, you doctors, go and address certain underlying concerns which you think are legitimate in this CBA. One of the issues which the court said is that you need to include, you need to bring on board county governments in view of the system of government which you have now. Now, the court gave the parties 90 days to go and negotiate, failure of which it will proceed to register DCBA. Now, what happens is that when doctors came to the negotiating table, instead of negotiating on the problematic issues which have a constitutional implication, they insisted on the implementation of DCBA. Now, from where I stand as an expert on policy and legislative development, there's no way you can implement DCBA without first addressing those underlying concerns. So to the extent that doctors have insisted that DCBA must be implemented without addressing those concerns, then in my view, the stalemate continues. So doctors need to come to the negotiating table, soften that stand, recognize the fact that there are certain issues that we have to include in the CBA, and then come up with a program on how to include those issues in the CBA. That means coming up with a new and amended CBA, which will then be taken to court for registration. And the stalemate ends in that soft manner.
Professor Wanzala, your reaction to that?
You see, I've been with the leaders of the union from the very beginning. And what Wanyama is saying here is far from the truth. We were ready. We looked at this document. We have sat with all manners of stakeholders. We have given scenarios of how to implement these aspects. Even the whole issue of saying that there are certain stakeholders who are not in. We were ready to actually incorporate all those stakeholders. All right? We are totally cognizant of the fact that there are aspects in this CBA that will not be immediate. But what we want to see is a CBA where we will be able to have trigger mechanisms of how certain things will actually be brought into play. On Sunday, just this other weekend, over 90% of what is in this document was agreed upon. Only come Monday and things have changed. Today, all of you witnessed the PS and the CS in the Ministry of Health. What did they say? They have been at what? At loggerheads, isn't it? That is where the problem has been. We have been in meetings where they should have come to attend, but none of them did what? Showed up. And yet they are the actual custodian of what? Of health in this
Is it
country.
true they sent junior officers to these
Exactly.
meetings?
They did. In one of the meetings I was there. They did. And that is actually the problem. When the Minister of Health does not take this issue seriously, this is the problems we have.
All right. Dr. Njuka, one of the statements that Eric Irende put out today says doctors are a special category of public servants. And if they don't do the job, if they refuse to work, it leads to lost lives, destroyed families, and a weaker nation.
Of course, that statement is true.
Therefore, they seem to be accusing you of being deliberately negligent.
But the first thing that you want to ask,
Humanity.
the first thing that you want to ask, the first thing that you want to ask yourself, Larry, is the doctor is a special category of public servants. But public servants, every public servant in this republic cannot, you can only work if there is an environment that is conducive for that work and you have tools to do the work that you have. But here you are. I've been in public service. I think this is my 17th year. You find situations where there are no tools, there are no gloves. The patients have to buy gloves for themselves. And this is a condition that has been continuing for the last 53 or so years that we've been independent. And so when you tell me that I'm a special category, but you don't enable me to do that work, then you are putting me in a situation where the doctors have reached and said, enough is enough. Can we take charge of what is happening in healthcare and make conditions conducive for taking care of the wananchi?
And Larry, just to add on, because I graduated from this country, I've worked in this country, okay? There was a strike in 1994 that lasted 6 months. And that was the beginning of flight of very many doctors from this country. And that was also the beginning of doctors beginning to ask themselves, can we have a union where we can be heard? All right? Ever since we got devolution, ask yourself, Is there any county in this country where healthcare workers have not gone on strike?
There have been reports that Bomet reached an agreement.
Yes, Bomet is a special what? Yeah, exactly. Yes, is there any county? And you see, that should have triggered what? Certain issues. What is going on? Tomorrow is Bomet, Kakamega, Busia. Where, isn't it? What is actually going on? A responsible government would have actually quickly sat back and said, no,
Okay.
there's something wrong in the healthcare system.
Thank you very much. I think
Every country, every county.
Real quick, then I'll come to it.
Yeah, in my view, one of the major challenges in this particular process is that, and very respectfully, doctors don't seem to understand that there are certain issues which can go into a CBA. For instance, you can't put issues in a CBA of a legal nature. Secondly, you can't put issues which are of policy nature. Of course, if you look at the CBA, there are certain concerns which are legitimate in terms of the workplace and all that. But if you want to insist that you're going to put the fact that a doctor is entitled to maternity leave on a CBA, and then you insist that then you're going on strike because of that particular issue, then to me it reinforces this view which I've had all along, because I've been involved in negotiating with doctors since 2013. The most problematic issue in this whole stalemate is that doctors don't seem to have proper legal counsel. They can't distinguish issues which require implementation. For instance, the government of Kenya has now developed the health sector strategic investment plan, the health policy, and the health bill. Some of the, in fact, 90% of the issues which are in the CBA will be addressed if those instruments are implemented.
Can I react to that?
Can we react to this? Can we react
I
to
was just
this?
jump to Eric. We'll take a break. We'll come back to all of that.
Let me
Okay.
take my space because I'm in government. And you know, the points which are being raised there are very valid.
But I sense there's a part.
But there are two things which are missing. The doctor there has talked about 53 years. There is a possibility here nobody is 53, maybe the professor. A situation which has persisted for 53 years has been taken very seriously by this government. That is the first.
How can you say that when doctors have been on strike for 17 years?
Yeah, exactly. Yeah.
How can you say that when doctors have been on strike for 17 years?
Let me tell you how I can say it. I don't want to get into a shouting match, but let me tell you how the government has done.
You just said a moment ago that they have failed
If you
humanity.
look at the diagnostic equipments bought by this government for county hospitals between 2013 and today, and between 1960 and 2013, you will change your mind.
All right.
If you look at the efforts made from State House by none other than Her Excellency, the First Lady herself, running a marathon,
Really?
you will realize that.
You're not serious.
Consciousness, just hang on there.
Serious.
Take a break
Spare
here.
you a year, spare you
I
a
need to take a
year.
break.
And Lali, you must give me space because I'm a special category.
Eric, you're right. I'm just taking a break. We'll come right back to you. We'll come right back to you. I see a lot of doctors in the audience. Please hold your
I will answer your
horses for a moment. I just need to take a real quick break right now on NTV. This is a special NTV on the doctors' strike and the way forward. This is a town hall from Power 254. We're going to take a really quick break. We'll be right back. Sector Town Hall from Power 254. Before we went to the break, we were having this conversation with Eric Iraide, Dr. Kivinji, and a bunch of other people on my panel right here, all of them important, just not introducing for the names. But I want to go real quick to the CEO of the Institute for Economic Affairs, Kwame Owino, who's also here. And you tweeted something which was interesting a couple of days ago. You've looked through the CBA, and from an economic standpoint, what do you see?
Well,
Go ahead, please.
what I see is it might be true that doctors are special, but the Constitution doesn't say so. And so some of the things we are locking in within this agreement would have constitutional barriers. That's a fact. So that's a first. The second is public sector wages. There's a policy for public sector wages. So unless we are going to argue that doctors are different, some of the staff that has been locked in are allowances that are not recognized under Kenya's public sector wages policy. And that too is a fact. Would the Salaries and Remuneration Commission allow it? I don't think they should allow this. And no wonder there's a barrier here. That stated, knowing Kenya's public debt position today, if all these allowances, and remember that an allowance together with whatever benefits that come may not necessarily be remuneration, but they have economic implications. It's unaffordable. That's a fact as well. So that's my point. Now that's not to say that nobody, even the doctors should have a right. You can agitate. You can even ask for $1 million. The point is, we must come to a point where it is consistent with what other Kenyans can pay for in terms of taxes. That's my point.
And Seko, you've been looking through both the developments over the last few days with the doctors going to jail, with the union officials going to jail for contempt, but also what is at the center of this, the CDA, and your view of that?
Okay. I actually, I'm a bit of, the lawyer in me is in sympathy with the doctor, to be very honest. Because, first of all, the things we are talking about are essentially constitutional questions, one may say. I mean, if you look at Article 41, the doctors are actually standing on all fours in terms of what Article 41 of the Constitution permits them to do. You have a right to fair labor practices. You have a right to a union. You have a right to fair remuneration. And you have a right to go on strike. That is what is an issue here in legal questions. And that's why I would have a little bit of trepidation in having someone go to jail for agitating their constitutional rights. I have an issue there. But that said, the other question that we need to talk about is, at the end of the day, we need to realize that what we call in the health crisis today, as we call it, really is not an entirely legal question. I think it's social, political, economic challenges for the country that are now being packed up and given legal whatever spin-offs. And that's where the problem is, because then the law risks failing us, because I don't see how you can order. It's well and good to have a court order that tells you go back to work. But essentially, I do not think I'm the kind of person, and I don't know anyone who would want a doctor treating them or taking them to surgery because a court has ordered that be done, especially if that doctor doesn't want to do it. And which therefore brings me to what the Court of Appeal, I think, captured in wisdom today, that this thing is not going to be resolved in the courtrooms. At the end of the day,
You heard.
the reprieve that we have,
I think they've come to the negotiating
Yeah,
table.
you've heard, isn't
the
it?
reprieve that we have is for the opportunity for what everybody seems to be talking about. We've talked enough about good faith. It's now time to meet our words with our action.
Absolutely.
Let's go to those rooms. Let's go to those rooms and resolve it. Because the unfortunate bit about this, I'm going to say this, there seems to be a template by which employers deal with unions.
Yeah.
You're given strike notices, you keep quiet, you ignore them. When the time comes, you run to court and you get a court order to force them back to work, and you hope you can wait them out. When they begin to suffer economic pressures, you threaten them, we will not pay your salaries. And you use this. That is not the way to negotiate. That's the
Larry, I just want, I want to,
Yes, I read
But
that.
that said also, I think we also need to look on the part of the doctors and ask ourselves, are we really losing ourselves in the process? Because I don't know how I can argue as a professional, for instance, that I am so much about my rights to agitate for my better pay and to agitate for better working conditions, to the extent that even within those working conditions, the little that I have that I can do, I jettison it. And I say, let a few patients die so that I make my point that I need to work under better working conditions. That too is something we need to reconsider.
Thank you very much for those sentiments that have been said by you, and I have got the answers for that. Number one, I think the first problem that we have got, even as Kenyans in general, because we are all Kenyans no matter what, we have come to a point where we've got a lack of patriotism for our country. We have got a lack of human dignity. We do not actually even almost care about the next person. And that is the first thing that is bringing a problem. To answer from the economic standpoint, doctors are asking for a total of 8.1 billion, alongside that budget of 2 trillion Kenya shillings. Kenya is a signatory to the Abuja Declaration that put healthcare at 15% for all its member signatories. 8.1 billion, if you may take your calculators or your phone calculators wherever you are at home, divided by 2 trillion, is not even 15%. It's not even halfway. So is that the money to actually agitate and actually be able to get this 8.1 billion? Yes, there is. That is one. Two, I agree with you fully. This is not from a legal standpoint. And this is also not doctors when we say that they're special, because I've been hearing this word special, and I'm beginning to question what special really means now. Because when we say we are special, it's not special per se, it's more of a unique circumstance. If I'm operating on a patient and I'm in the public service, I operate from 8 to 5 and I've just opened the abdomen and the intestines are out. Do I stop because it's 5 p.m. or do I continue? I have to continue, and that has got to be taken care of. Sometimes you've been able to stay awake even for 36 hours. You've not even slept, you've not eaten, and you're a human being.
Oh,
Those are the things that we have to look at. If that is what special means, and by any means, we are very special.
I was defining the problem here, and I said, one, the problem is management of change. I am really impressed at the age of people here. They are all very young, and I have also met your union officials. They are also very young, and I understand the speed with which they want the country to move. I have had the Learned Council here, those kind of arguments throughout, and I don't know why they have not convinced the doctors to go back to work as we continue. But the point I want to put across here is that one is our management of change and how we perceive it.
Okay.
We are very underdeveloped in terms of health. And the 15%, if you took even half of it and give it to remuneration, then I think that is missing the point, because in terms of infrastructure, we are very poor going by the reach of this country.
Okay.
The next thing, and this is the thing I think we missed somewhere as a country, it is the rule of law.
Why do you
There
say
is
that?
a reason why courts exist. And I want to say this, it is not about doctors. It is about politicians campaign within the rule of law.
I want to keep
They
it to
still
doctors.
feel-
I want to keep it to doctors.
I want to be
Let's just-
contextual.
yeah.
I want to be contextual.
All right.
It is doctors. Let it go on record, viewers, that it is doctors who first went to court.
Okay.
And the court gave an order. It is not the government which jailed the doctors, which the doctors not only decided to be in contempt of,
Okay.
they went to the media and said, we are in contempt of it.
All right.
You
I have
do not
to-
have the rule of law.
Okay.
I have to
that
leave
kind
it
of
there for
environment.
the time being. I want to get 2 comments real quick from the audience. There's a lady in the back. Get a mic somewhere at the back there real quick so we can hear some. Please pass the mic to the back so we can hear some voices real quick. Introduce yourself, please stand, and then make your point. Yes, go ahead.
Good evening, everyone.
Hey.
My name is Dr. Kagola Kitao. I work at Moi County Referral Hospital in Voi. And I'd like to say the government spokesman has said a lot of things, told us that we failed humanity. One thing I'd like to say is that the problem we have is that we have elite people who do not understand what is going on in the everyday Mwananchi life. We have people making decisions in Nairobi, decisions that affect people all the way where I work. And I'm sure most doctors here, we had so many strikes since demolition started. I don't know whether the spokesman knows the number. If they know, that's well and good. What are they
43.
talking about them? We've had them bring in machines. They talk about changes that have been coming through. Today I had a very interesting statement. One of our senior professors told us, back in the day, they used to transfer patients from Aga Khan Hospital to KNH because KNH offered better care, was better equipped than
Alright.
some of these private hospitals. We have equipment brought to the hospitals, radiology machines. We have 120 radiologists in this country. These machines are being bought using taxpayers' money. Who's going to use these machines?
Okay.
As we speak, most of these machines at the moment are sit and used in our facilities.
All right.
We need the people in charge to actually understand what is going on in the average Mwananchi's life.
All right. I will take this. Where's the mic? Yes.
Could I respond to?
I've got this lady to. I have to take a break. I'll come back to him. Just make your point real quick.
Thank you for this opportunity. My name is Dr. Roena Wairimu. I work for Murang'a County. First of all, I think we can all see when this thing started, there was lack of good faith. The first thing that we were addressed as, we were called a disgrace to humanity because patients are dying. What I want to emphasize is the government has let its people down for so many years because I am tired of going to a facility that does not even have a generator to use the oxygen concentrator so that my child does not die of pneumonia. I'm tired of losing children due to asthma because there's no electricity to use a nebulizer. I'm tired of supervising death. So who is failing humanity here? Is it me or the government? I am there with my skill. There's no equipment. How can you buy an MRI machine for Muranga? And I work in a facility that does not have a full hemogram machine.
Right.
What is that MRI machine helping me with, and I don't have a neurosurgeon? I still have to take the patient to Kenyatta for neurosurgical review, and there's a machine gathering dust there. What are you saying? We are a disgrace to humanity. What are you saying that you're special when doctors are donating their blood? Yes.
Article 5. Article 5.
No. It is in the CBA.
Article 5. Read Article 5. Article 5.
Let the doctor finish. Yes, go ahead.
The CBA stipulates that my working environment should be enabled.
Article 5.
Stipulates that my working
correct,
environment
but it
should
is
be
here.
enabled. I am just seeing that people are telling us there's no economic power for this country to pay 8.1 billion. All of a sudden, there was a lot of something like 4 billion for people to give themselves as Christmas bonuses. MCAs use in 6 months more than 4 billion just for traveling. Is that traveling more important than the lives of Kenyans? And then we are being told we are young, hot-blooded doctors, that we are in speed of this thing being implemented. What has happened is the healthcare system has crashed all at once because of accumulated problems. And we were decided we will not sit and let this happen for years. 3 years negotiating a CBA is not hasty. We have been patient.
All right. You all have points. Let's keep them when we come back from the break. If we could. I just have to sneak in a quick break right here. We're coming to you live on Power 254. This is an NTV special on the health sector. We're going to be right back. All right. And we're back live here in NTV Kenya. It's in a town hall on the health crisis from Power 254. It's a very heated debate during the break. Where should I go first?
Here.
Yeah.
Right here, Larry.
We need to clarify
I want to
something.
hear from the doctors. Dr. Eva at the back here has an important point that I want to be able to get through. Introduce yourself and what you do, and then make your point.
Good evening.
Good evening.
My name is Dr. Eva Langat. I'm an orthopedic resident in Kenya. I have 3 things to ask.
Real quick, yes.
Kirai there mentioned, the government spokesman mentioned that the Beyond Zero. My understanding is mother and child healthcare is a provision of the government. Under what circumstance is it being funded by charity? And why are you using taxpayers' money to fund charity? 2, contempt of court. Doctors were sent to prison. Kaiseri has a warrant of arrest. Alfred Mutua, Kibicho. They have police bodyguards who have the power to arrest them. Why are they walking the streets of Kenya? You tell me that the CBA cannot be funded by government. Do you have a budgetary allocation for corruption? Yes. Such that you can finance corruption and not the CBA.
All right, I'll get to you. Let's get a few more voices.
Larry.
I'll come to you, Dr. Chuka. Yes, go ahead.
Yes, I'm Dr. Washira Martin, a dentist by profession. My question goes to our lawyer.
Thank you.
I think I've had a diagnosis for the problem. You're the diagnosis for this problem. In that, if you're part of the advisory machine for this whole government and county, because at first you said that some of the issues in the CBA are supposed to be in the CBA.
Yeah,
the government was there during the negotiation of that CBA. When didn't they raise those issues then?
I'll respond.
You come now and say they're not supposed to be in the CBA. 3 years. Where were you back then? Government.
All right. We have one more person. Why were there issues in the CBA if they're not supposed to be in the CBA? Like you were saying. Let's get the mic to the gentleman at the back first. Yes, sir. Stand up, introduce yourself, and go ahead.
Hello, my name is Dr. Jomo. I work in one of the mission hospitals in Kenya. I just wanted to ask Honorable Kiraithe and the distinguished lawyer whether they've ever been to a public facility, gotten healthcare from there, or if so, when the last time they were in any of our public facilities, not visiting on official government basis or donating something. Have you ever gone to seek healthcare from there?
Peter Onyama, do you have to go first?
Yes.
Have you ever been to a public hospital?
Of course, I've grown up from. If you look at my hand, I was treated at Bungoma which is a public facility.
When?
When? In 2013. What I want to emphasize here,
that's when the
what I want to
negotiations with
emphasize
CBA
here
started.
is that I think I know where there's a problem. Let me just explain this. I think I now know where there's a problem. Let me explain something. In the Constitution, the government has under an exclusive and resolute responsibility to invest in the health sector. Secondly, it takes time to invest in the health sector.
Start now.
Thirdly, is that you cannot put these concerns about investment in the CBA and then you say that we want you, the government, to invest in the health sector now,
Correct.
and therefore we are going on strike. In my view, these are not CBA issues. What we need to do is that we need to distinguish CBA issues and non-CBA issues.
Okay.
And CBA is a collective bargaining
All right,
agreement.
because
It's not an investment policy.
Dr. Juka has been silent for a bit.
Yes.
Dr. Juka, you haven't said something for a while. Go ahead.
Okay, and this is what I wanted to say.
Real quick, yes.
That the reason why some of those things that Peter doesn't want to be in CBA are in CBA is that for the last over 50 years that we've been independent, the government has had policies on how to give supplies to hospitals. I have worked in public hospitals for quite a bit of my life, and you are told you're supposed to get drugs every 3 months. That's our government policy. But most often you will not get those drugs. You are told that you will get supplies. You don't get supply. So what do? We want to find a clear framework. Even if it is investment, we want the government to tell us what is the clearest means of investment on those areas, so that they take responsibility that they are supposed to take.
Let me give questions. I have actually been to hospitals in places where many of you have not been. I have been in Kanyarkwat. I have been in Kanyarkwat.
I worked in Kapenguria.
I have been in Marisabit Hospital. I've been in Moyale. I have been treated in Hola. And if any of you is here from Kisumu Hospital, 2 years ago, I ferried accidents from Keve to Kisumu and stayed there until they got treatment, and I contributed in meeting the gaps. Now, let me make a point very clear here. There is a reason why people who are educated were recognized. The minute doctors start comparing themselves with MCAs,
we have not.
The minute
we are not.
No.
That's
using a measuring yard
Larry,
based
that's not true.
on corruption. Of course, the government has a huge budget on corruption going to.
Thank you for agreeing.
Going to the director of public prosecutions, and it is going to the jails where you must go when you are corrupt. And I hope doctors are not political activists. So,
we are
let's look at it very clearly.
Larry.
And when it comes to human health, it's unfortunate the Beyond Zero marathon has been cancelled this year because of politicization. When it comes to human needs, donation, philanthropy has not been discovered in Kenya. It is an international practice. It is something Bill Gates does. It is something all rich people.
Let me use this.
Yes. Go ahead.
No. Now, on the issues of allowances, okay? We were in the commission.
I've only got about a minute. So
yeah, we were in the commission for remuneration. The circumstances under which doctors work allows those allowances. And they are in the document that is going to be implemented beginning when? July. Those ones are totally there because of what we do and the circumstances in which we work. All right? And that is budgetary. Number two, why are we here? We are here because of problems that keep being pushed under what? Under the rug. Till the rug is what? Exactly. And one of our politicians said, they come at a time. The time is what? Now. Are we together? Yes. The time is now. And I'll give you an example. Karibi. I have had an opportunity because of what I do in terms of research, okay, and looking at how well diagnostics are done in this country, to walk around and look at what goes on. What the doctor from Moranga said, I saw it just the other day when I was in Lodwar, last week.
Okay.
I was looking at polio. Lodwar has an MRI, but they cannot do a hemogram. They don't even have a microscope to look at diagnosis. Number two, Larry,
Yes.
just give me a
Finally,
minute.
in 10 seconds. 'cause
No, give me a minute.
break.
Give me a minute.
I have time coming up in the next 9 minutes.
Yes, but let me just finish this.
Real quick, yes.
Now, the other issues are this. You sit in one county, they have an orthopedic surgeon. You are in another county, they have no orthopedic surgeon.
Okay.
Now tell me, in terms of management, how do we want to do that? That is what we are trying to address here. Are we together? This is what we are trying to address here.
Ladies and gentlemen, I want to leave it there just for the moment because we have to take another break on NTV. This is our town hall from Power 254 on the health sector. At 9 p.m. we'll come back to conclude. Right now, though, we'll have to take a break for the news.
And staying with the health crisis, we now cross over to Power 254, where a special health debate is being held by our very own Larry Madowo. Larry?
We want to finish up the final part of what has been a very passionate town hall on the health sector crisis and what to do next. Real quick, I want to get through my guests one more time. Eric Wright is here, the government spokesman, Dr. Janet Gethinji, and Peter Wanyama. We've got Professor Omwanzala and Dr. Daniel Ujuka. We've got doctors in the audience as well as an economist and a lawyer and lots of other people who are stakeholders in this sector. Before we went to the break, we were talking about what needs to happen now. If the government gave the money that the doctors are asking for, Dr. Gethinji, will you go back to strike? If it's just the pay increase, will you go back to work?
No, because in the first place, even the money that has already been allocated, if it was just about money, we would already been going to work.
The headline here, everybody says that doctors are asking for a 300% pay rise. Is that true?
For every time I hear the word 300%, I really want to just cry.
So that's a no.
The word 300 does not exist in the CBA. 300% does not exist in the CBA, not in our dreams, nowhere.
So, Professor Anzala, even if that pay rise is given, what else needs to happen before doctors resume work?
You see, part of what we are saying is that we agreed here that the problems have been accumulating. And hence you see the idea that things must be resolved. And the reason why we are saying resolved now is because of accumulated problems. I'll give you an example. In this CBA, we have talked of research. Are we together? We want to be able to do research at every level in the county to then inform policy. Because we are assuming that Kenya is the same. That what is affecting Garissa is what is affecting Kisumu. And yet we know that there are geographical differences. What we are also saying is that we can give scenarios. How would we raise money for research?
Okay.
All right? The issue will be this, that in nearly all these places, there's a user fee. Are we correct? Hospitals are not entirely for free. Some of this money can be channeled into into local research in those counties.
Advocates,
yeah, I think
Peter Wanyama advises national and county governments on the health matter.
Thank you very much. I think in my view, you cannot achieve the issues and the concerns which the doctors are raising over it. These are issues which are supposed to be achieved problematically over time, but more importantly, with increased investment in the health sector. If doctors are going on strike because the government has not yet established a research fund, which of course is not entirely true, because we have a policy and legal framework for research. What we need to do is that we need to scale up activities in this, and it takes time. So if doctors are going to go on strike forever because the government is not putting in money in the same manner as the government of South Africa is doing, it means that we are really sabotaging the Kenyan people. So in my view, I encourage the doctors. The concerns which you raise are actually legitimate. However, it takes time to invest in the health sector to realize the objectives which you people want.
And that is exactly, Mr. Wanyama, what we are saying is that we don't want the government to tell us that all our problems will be solved tomorrow. We are not imagining that. What we are imagining is that all these problems that are there, governments give us a framework of how they are going to put that investment. That is what we need, so that we know that our problems will be solved, but next year this part of the problem shall have been solved. In 5 years, this other part of the problem shall have been solved with this amount of investment. No, it's not.
No, it's not there.
Yes, sir.
It's
Yes,
not
sir.
there.
Go ahead. Introduce yourself
You know,
and,
it's not there.
Go ahead.
Good evening, everyone. Thank you for this opportunity to speak.
What's your name? What do you...
My name is Ryan Yotoketao. I'm a medical officer from Embu, a county which is on strike for the 80th day. Our reasons for the strike were the following. We wanted more consultants employed. That was one of the main issues. The government tried to, the county government put an advert to get more doctors. No doctor from Nairobi applied for that job. Why didn't they apply for that job? Why didn't they apply for those jobs? It is because what they're being offered does not pull them, cannot pull enough. We are not investing in our pull factors to keep doctors here. You have been called young and hot-blooded. Yes, I am young, and yes, I have been educated, but I don't want to leave. We are that generation that knows what is due to us, and we want to stay, and we want to fight. We want to make this generation better. We will not let it be the next generation. We won't let it be that in 20 years, we are fighting for another CBA and complaining about how brain drain in the medical sector is still killing it. We have said now is that time where we are going to fix this, and that is the CBA. That is what it is. It cannot be cheapened, it cannot be reduced.
Okay.
Thank you.
I want to be on here to tell Kenyans that in Ethics and Anti-Corruption Commission, in judiciary, in the police, in prosecutions, we have a huge budget provided by Kenyans to fight corruption. Having clarified that, what my enthusiastic, well-educated, and well-intentioned colleagues here
hot-blooded colleagues
have put across, it doesn't, hot-blooded is a bit negative. They are very reasonable people and rational. Is that what they are fighting for is social and political change. And to all intents and purposes, today I was saddened to see the battery of politicians there, but to all intents and purposes, in all legal practices, in all jurisdictions, I have understood it, you don't put politics and social change in CBA, you put it in political party manifesto.
Dr. Gidenji, I need to get this gentleman up, but you go first. Real quick, I have to finish up.
Yes, I need to respond this, and I can as well even say my closing remarks as it is just now. Social and political change is very important. And there's one very good president whom we also had, no matter how long we had him, but there's something he once said and it stuck to me even when I was a young child. Siasa mbaya, maisha mbaya. And we need to now move from this kind of politics and move to issue-based politics. Even as the politicians came, we were very categorical and we kept on shouting, no politics. We repeated that for a very long time. We are not because of any political particular affiliations, but the most important thing, and I can actually appeal to the middle class, let us now stop privatizing public problems with private solutions. The three arms that we keep on feeling are our pillars of being able to assess an economy is education, healthcare, and security. If you've got good policemen and if you've got happy policemen, then you've got good security. If you've got good city council schools, which I believe we all went to, and we still made it as doctors, then we'd work properly, and good public hospitals, then we'd also be okay.
I want to get the final comments from the crowd. Thank you, Dr. Gidenji. Yes, sir, go ahead.
Good evening, everyone. My name is Dr. Karevi. I work in Baringo County in Cabernet Town, and I must first commend my county for all the efforts I've made in improving the health system in the county, despite all the challenges. That aside, I'll pose a few questions to you after painting a picture. Health, or rather, HIV care in Kenya is funded through American dollars. TB care in Kenya is funded through American dollars. Malaria too has American dollars paying for it. I have a father in this country. Mr. Kiraide here is like my father. Why is it that my neighbor's father is the one who's feeding me? Yet, for the last 53 years, we have been an independent country with working Kenyans generating revenue for this country. These are the issues that we feel our government are not addressing. And we are trying to do that as Kenyans through the CBA. Thank you.
I have to leave it there, guys. Thank you all so much. We appreciate all of the time that you have spent with us and trying to help us understand the issues. Professor Anzali, you understand? In 10 seconds?
10 seconds. The doctor from where? Embu.
Yes.
You see, part of what we are saying is a human resource. And that's why I was talking about, if you are an orthopedic surgeon here and you don't have one here, what do we do? The whole issue we are saying is that let's move away from the issues of doctors, especially specialists, being assigned to what? To a particular county.
Right.
These specialists can do what? Can actually rotate.
Okay.
And these are the suggestions, the scenarios we are trying to give government, such that we have a paradigm shift
All right.
in the way we
It's actually a
manage,
concern that
in the way we
the
manage
president
healthcare in this country.
I can't start this discussion all over again, so I have to thank all of you really so much for sharing your time with us, our panelists, and for all of you in the audience. Thank you so much for coming out and helping us understand the issues a bit more. That should be, thank you so much. That should be all the time we've got from all of us and the team here at Power 254 for our town hall and health sector. And next week on Wednesday, same time at 8 p.m., we might have something special for you. Back to you now, Gladys and Mark.